All right, I feel like this is a good time to start. So, good morning, everyone. Happy Friday once again. Thank you so much for joining us for our Domestic Violence Training Series, Part 1, Domestic Violence 101. Just as a reminder, this is a three-part series, so the next two webinars will take place on October 18th and October 25th. On October 18th, we'll talk more about domestic violence and impacts on children. And then on our final webinar, October 25th, we will discuss domestic violence and legal considerations for the immigrant community. However, today's training is Domestic Violence 101. Today, we will discuss the prevalence of domestic violence in the US and LA County. We will identify red flags and signs of abuse and domestic violence and intimate partner violence situations. Um, we will talk about the differences between healthy relationships and unhealthy relationships for staff to observe. We will also learn about utilizing trauma-informed crisis response to support survivors. And then we will conclude the webinar by sharing a list of referrals for LA County Domestic Violence Services and other victim service providers. Just a few housekeeping tasks before we get started. Please use the Q&A box to submit any questions for our speaker. We will have time to answer questions after the presentation, but just to be fully transparent, we did have about 360 people register for this webinar. Just in case we don't get to answer your question, please make sure to fill out our evaluation after the webinar. And then there's a question that asks if you have any further questions for the speaker. We will be sending over that list to our speaker, and then we can share it out consortium-wide. And then also this webinar is being recorded. So that means all the slides and handouts will be sent out to those of you on the call, probably sometime early next week. And then just a final reminder, after you leave the webinar, you will be prompted to a SurveyMonkey link that will be our evaluation. Please take a few minutes to fill out the evaluation after the webinar, as it helps us know how we did. And then it also helps us plan future trainings for you all to see what is beneficial to you and your communities. All right, with that being said, LABBN and the consortium is extremely grateful to partner with Peace Over Violence for this training series. Our speaker today is Yvette Lozano. A little bit about Yvette. Yvette has contributed to Peace Over Violence for over 23 years. Peace Over Violence was established in 1971 and is a sexual and domestic violence, stalking, child abuse, and youth violence prevention center headquartered in Los Angeles, California, that is dedicated to building healthy relationships, families, and communities free from sexual, domestic, and interpersonal violence. As the Chief Program and Operations Officer, Yvette is a trauma-informed trainer and a subject matter expert in abuse prevention, domestic violence, teen dating violence, sexual assault, and a lead instructor for Peace Over Violence Empowerment, Self-Defense, and Safety Program. Yvette, thank you so much for joining us this morning, and I'll pass the mic over to you.
Thank you so much, Anna. Thank you everyone for being here today. This month is Domestic Violence Awareness Month in October. And as an organization that serves survivors of sexual and domestic violence, I'm so grateful for all of you for being here and wanting to get more information on how to support community and members of our community who may be experiencing domestic violence. I do not need to go over the objectives today. They were been mentioned already, and I do welcome questions, and I believe those questions will be monitored, and I'm happy to answer those. And again, if we don't get to your questions, I will follow up with those questions afterwards. So let's get to this. We're going to talk about family violence and domestic violence. There are going to be some issues or discussions, topics that might be a little bit sensitive. I do want to offer that you please take care of you. If you need to step away, take care of yourself, grab a glass of cold water, just kind of monitor your body, your emotions, because this is a very sensitive topic that we will be discussing today. So take care of yourself, just like we all take care of our clients in our community. I also want you to do the same for you. So when we're talking about family violence is in any abusive behavior that exerts power and control over another family member. And that could include a family member that could be a parent, a child, or a sibling. That's a general term. When we're talking about domestic violence is more of a term that we use, also intimate partner violence, that consists of any abusive behavior that is acted upon any romantic or intimate partner. And I'll get a little bit more into that. And What I want to cover here is that both of these types of violences have specific laws that protect victims and where we could provide support services and guide them through the process. But we really want to understand what the dynamics are and the types of abuse that occur within these two types of issues of violence. We know that in family violence, many cases that we have experienced or seen are acts of violence towards children, and that can include child abuse. We know that 17% of child abuse victims are physically abused, and while 74% of children are neglected. 16% of alleged child abusers are also uh, perpetrated by other children. And sometimes those are the types of cases that sometimes don't get reported, or maybe there's not enough signs or warning signs. So we're going to talk about that. We also have at Peace Over Violence have been seeing an increase in cases of child to parent abuse, CPA. This includes abuse of a parent or a caregiver who has been victimized by a child or someone that they're caring for in the home. And that's also considered to be family violence. And family violence also consists of elder abuse. 1 in 10 Americans age 60 and over have experienced some form of elder abuse. In domestic violence, we want to really understand what that means and what that looks like. And a lot of times when I'm working with survivors, really helping them understand what it means to report a crime of domestic violence or intimate partner violence. So we know that domestic violence is a crime. It is against the law for anyone to physically harm or harass another person, specifically an intimate partner, a child, or any other human being. In California, the law says that police shall arrest a person who they think has reason to believe that the person has suffered abuse from that other person. We know domestic violence in many cases can lead to murder, and this is why it's so important to have these conversations and understand the prevalence of domestic violence, intimate partner violence. 3/4 of all women who are murdered by their husbands, their ex-husbands, or their domestic partners. And I mention women here because 94% of victims are female women victims, but we know and have seen an increase in male victims reporting and coming forward. Domestic violence overall, it impacts our community, it impacts families, but it also impacts our economy. We've seen that an estimated 3 to 5 billion annually in job absenteeism, and another 100 million in annual medical expenses when victims show up to medical ER rooms or clinics seeking medical services due to injuries or harms that they've experienced. Just a few statistics so that we have a broader idea of how this is very prevalent in our county and in our country. 1 in 4 women and 1 in 9 men experience severe intimate partner physical abuse, sexual violence, or intimate partner stalking. This can lead to injury, fearfulness, post-traumatic stress disorder, the use of victim services. And also, we're going to talk a little bit more about the contraction of sexually transmitted diseases and when we break down the types of abuse. An average, nearly 20 people per minute are physically abused by an intimate partner. If you think about that, 20 people per minute, this is an increased number. However, we know that domestic violence is underreported due to specific challenges and barriers that victims may experience. For 1 year, this equates to more than 10 million women and men being victims of domestic violence, intimate partner violence. The presence of a firearm makes domestic violence 5 times more likely to be lethal. And this leads and is connected to gun violence in our community. We've seen that many of the gun violence situations that has happened, the suspect has either been accused of or been convicted of previous domestic violence incidents. So there's a nexus there that we really kind of need to look into. when we're talking about intimate partner violence, we got to think broader, that this is not just an issue of abuse that happens between adults. We need to consider that, and we know that in our work in domestic violence field, that teens also experience these types of violences and these behaviors, or execute these tactics that we're going to talk about. Similar, the domestic violence and family violence um, are tactics and behaviors and crimes that could be very similar to each other. So we're going to break that down right now. And if there's any questions or definitions that may come up for y'all, please feel free to ask any questions, and we're monitoring those as well. So I know that many times we think about domestic violence as just physical abuse, but there's more to that. And there's the egregiousness of cases has increased post-COVID, or actually during COVID and now post-COVID. There's different crimes. Some of these, we're going to break it down, but I really want to say that some of them are against the law, and their victim can report to police, and some of them are tactics that abusive people use to control or exert their power or coerce individuals, people who are less vulnerable, into abusive patterns or behaviors. So we have these 5 topics here: physical abuse, sexual violence, verbal, emotional, and psychological abuse, economic, legal abuse, stalking, technology abuse, and harassment. These are all the most types of abuse that we see in our organization while we're working with survivors, that are very egregious and or just behaviors or patterns that are used again. So let's go over those and review them, and I'll break them down for you a bit. So physical abuse can mean any type of hitting, punching, pulling hair, slapping, restraining or blocking, or trying to not allow them to leave a scene or a situation, throwing objects. Reckless driving has been one that has increased. Currently, we're working with CHP to help them understand the dynamics of abuse, and they've seen an increase in this. Locking out of the house, food deprivation or force feeding could be a tactic. Attacking with weapons, shooting, burning, forcing them to use drugs. Human trafficking has been one of the tactics that has been used, and it is against the law. Transferring one human being to one county to another, from one city to another, forcing them for domestic servitude, bondage, or sex trafficking. At the end, many victims suffer and end up being murdered by their partners or ex-partners. And there's also murder or suicide, murder-suicide, where the abusive person ends up taking their life at the same time, killing, murdering the children and or the victim. And so that's something we really need to look into. And we'll go over some strategies for that. Choking is something, that's when something gets lodged in your throat. The legal term with domestic violence is strangulation. It's something when someone is holding or forcing you through the neck, or has injuries. Those strangulation signs are very important, because that strangulation can lead to death of the victim or severe internal injuries that they might require medical assistance. So we will go over that later in the presentation of how to look for signs for that. Sexual assault, sexual violence is something that is very underreported in domestic violence cases for many reasons. The term sexual violence is non-legal term, but it encompasses all the other terms that are against the law, which includes rape, forced sodomy, forced oral copulation, and acts committed with foreign objects. This also can include harassment, sexual harassment, or any unwanted sexual activity where the victim is unable to give consent due to their maybe being incapacitated, or maybe there's fear or being coerced into doing or conducting sexual activities that are unwanted. So what is sexual violence and what does that consist of? Well, I highlighted here in red spousal rape or partner rape. This is one of, like I said, one of the most underreported crimes when victims are reporting sexual abuse. They don't consider sexual assault or sexual violence to be a crime because they feel like it's maybe it's a cultural thing. Maybe they feel that they have to do these acts of sexual activities, but they're being forced to or coerced into doing so. Rape, attempted rape, sexual assault, sexual battery is another form. Sex trafficking, like I mentioned in the previous slide. Sexual name calling, it could also lead to emotional and psychological abuse. Sexual harassment as well. Demanding sex in ways that are unwanted or denying the use of contraception. So it's not against the law to be having sexual intercourse with a brings a sexually transmitted infections or diseases to their spouse or partner. It is important to identify that as a tactic for survivors so that they could understand that that's a way of maintaining control and power over that person. The other part is any sexual activity that the person lacks the capacity to consent, as I mentioned. It also consists of fear. If that survivor is in fear or fearful of saying no or not wanting to have sexual activities with a batterer or their partner, it is important for us to validate and support that survivor through that process by educating them about these issues and the tactics that are used as well. What is a verbal, emotional, and psychological abuse? Well, working with survivors for many years now, I think that this is the most difficult and challenging types of abuse that we could prove in court, or they could prove to police that they're being emotionally, verbally, psychological abuse. And these tactics are very strategic on how the abusive person uses them against the victim. And so any type of uh, preventing or verbal attacks, degrading, humiliating, whether in public or just in one-on-one, any forms of threats of using violence against the victim, survivor, or threats or against children or about maybe taking the children. Threats of harming pets as well is a tactic that is used to control the survivor. And we have ways to protect pets now with adding them to restraining orders. That's an option. Uh, like I mentioned, threatening to kidnap the children or taking full custody of the children, ignoring the survivor's feelings. If the survivor is expressing how they're feeling and expressing that they're feeling that they're being manipulated or emotionally abused, the abuser's not taking accountability and also maybe undermining the victim's sense of reality, uh, denying what they're doing. I'm not abusive, I'm not hurting you. So that's what we call gaslighting. Just undermining that victim sense of reality is a real big issue for survivors where they're kind of second guessing themselves about. And so that really impacts their capacity to seek services or support or even disclose to anyone. Also, failure to respect the survivor's privacy, coercion is a big thing and can also be used now in restraining orders if it explained properly. Bullying, also name calling, abusing the children as a way to harm the victim. Not harming the victim, but harming the children is a tactic as well. And another is suicide attempts, telling the victim survivor that they will take their lives if they leave them or if they take the children. Those are also tactics that are used in a domestic violence situation. Now, All of these that I just mentioned, I'm going to pause here, um, is not only, these are not only tactics that are used in intimate partner violence, domestic violence, these are also tactics that are used in family violence. The sexual abuse. We know that in elder abuse, elder survivors may experience verbal, emotional, psychological abuse and sexual violence, inappropriate touching, um, physical abuse. We know as children living in a home where violence is present, children can and also may experience sexual abuse, neglect, physical abuse. All of these are not just separate, but they're also part of family violence and intimate partner violence. So when we're trying to identify red flags on how to best support survivors, we got to think of this as a whole bundle of issues of trauma coming in a home where it's impacting the home environment, it's impacting the individuals that are in the home that are being exposed to these types of crimes or violence. And we got to figure out ways to best support each individual, because everyone is different, right? So when we move into economic abuse, that is another form. And economic abuse could also be used in elder abuse cases, but is also used in intimate partner violence cases. This is also a legal form of abuse, that it could be reported to police as a tactic or any type of situation. So some of the tactics that are used by an abusive person are tactics that are controlling the money, not allowing them to spend money, uh, also controlling food and clothing and shelter, not allowing the survivor to have any decision making of the home and the expenses. Also sabotaging attempts to go to work or to school for the survivor to progress. Um, Not allowing them to go to get a vocational training, refusing to support the family. That means the abusive person is refusing to contribute, and also making the survivor work, and they're the income winner. And so that is another reverse tactic. The other is not giving them the transportation or allowing them to take any form of transportation. We've seen an increase in fraud and scamming and using bank accounts or credit cards or documents that will inhibit the survivor to have a good credit score. And of course, running up the survivor's credit card charges so that they have a negative score that could also impact their ability to leaving an abusive situation, uh, and not being able to have money or funds to sustain themselves. And that is a tactic because now the abusive person is knows that that survivor is solely dependent on him or them to stay in the relationship, so that this really limits the survivor's ability to escape violence, and break that cycle of violence. In elder abuse cases, we've seen the same tactics used here, and also when with some cases that I've seen is having access to the bank account and taking money directly from the person's account. And at the end, that person is left with no funds and not able to sustain or pay for food or clothing or any other necessities that they may have as well. Another type of abuse, and this is the one that is the most frustrating for survivors because it brings in the legal systems, and it really is very difficult for survivors to manage through the criminal processes, and also the dependency court processes. So some of the tactics is that abusive people can file restraining orders against the victim, accusing the victim of being the batterer, when inside that person is the batterer and the victim is the victim. So there's cross-reporting and blaming each other. And so this is why it's so important for us to train law enforcement on how to best respond to domestic violence incidents, and conduct a proper investigation processes and identify the primary aggressor in cases of incidents of domestic violence. And that's what is happening, I know, in LAPD, but we still have a lot of work to do in training additional law enforcement entities to best support and respond to domestic violence cases. Threatening the victim to have them declare incompetent to DCFS or other social service agencies. This could lead and is connected to the emotional and psychological abuse. I've seen cases where the abusive person calls DCFS against their partner, and the children then are removed from the home, and then custody is given to the abusive person. That also becomes a challenging issue. I'm not sure how many of you work directly with DCFS cases, but sometimes a DCFS response brings up additional barriers for survivors, and it makes it very challenging for them to comply with the demands or requests that DCFS requests for them to go through. And this is where we feel it's important to have a domestic violence advocate, such as us at Peace Over Violence, to guide the survivor through these processes, accompanying them to court to best support them through this process. Reporting the victim to law enforcement and filing reports against the victim. Again, this goes back to the training of law enforcement to ensure that they're arresting the person that's causing harm and not the victim. And they're also the tactic of misuse of power of attorney and other legal authorities. So taking that power of attorney and making decisions for the victim due to maybe medical issues or decisions that need to take place, that abusive person is making those decisions instead of the victim when they are able to make those decisions themselves. Stalling the legal process, such as divorce or child custody. And also stalling the criminal process too. Legal abuse also consists of a person having access to a defense attorney or an attorney attorney in general to prosecute or rebuttal the case of a divorce or child custody. And sometimes survivors don't have the financial resources to have representation and guide them through that process. This is where I would say that a legal advocacy center that hopefully provides family law services would be ideal. But unfortunately, there's not a lot of agencies, I think maybe there's one, that provide these in-depth services for family law and representation on divorce and child custody cases. And so what happens here is an abusive person may stall the proceedings. I have cases that sometimes I think they go on for 3 to 4 years. Can you imagine having to go through that process on top of being victimized and harassed, emotionally abused? Those are things that, again, tactics that an abusive person uses to still have control over that person. Another form of legal abuse is not paying child support or ignoring the request for supporting a child financially. The abusive partner hiring the legal representation is something that I just mentioned right now. So any others that you could think of, I would encourage you to put them on the chat. I would love to see that because, again, these are things that are coming. These are things that are new tactics, new issues, new trends, and that we see. And these are the most highlighted ones that prevent survivors from seeking services or maybe breaking that cycle of violence. One of the most difficult cases to prove is the stalking situation. And that is mostly difficult when the abusive person and the survivor have already, left the relationship. That it takes about 7 to 8 times of survivor attempts, to leave an abusive relationship. And once they leave that abusive relationship, it doesn't mean that the violence stops. The violence or the tactics continue in some shape or form. And stalking is one. Showing up to the home, showing up to places of businesses or work, school, anywhere. And they're just the presence of seeing that person that has been harming you is very impactful to the survivor. Cyber stalking and cyber harassment is another form that has been increasing in ways that victims have been reporting that this is most difficult to prove and show. But let's go over some of these. Threats through email, threats through text messaging, threats through social media platforms is a form of abuse. Sometimes, like I said, that passive covert abuse it's challenging for survivors to gather that data or gather that proof to show they have been or are being victimized. Uh, Being followed or putting tracking devices into a car or putting cameras in the home where the survivor does not know or is aware that the cameras are there. Sexting, inappropriate sexting or images or messages that it's unwanted. Voyeurism is another, just standing in front of a window outside, just watching a person. Sending hate, obscene, or threatening emails or viruses via spam to control or manipulate a computer or a camera. That has been something that has been utilized a lot more since COVID. uh, Tracking victims' whereabouts, and also uploading any apps or tracking devices into iPhones or Android phones. Some of the tactics that are also being used is also those apps where you could monitor text messages or phone conversations, or listen into phone conversations that an abusive person has done. That's another tactic that is used. And also sending inappropriate videos, maybe from previous intimate relationships, and this could lead to sextortion, meaning that the abusive person will use or threaten or blackmail the victim with images and saying that if you don't come back to me, or if you don't return to this relationship, I will post this or send this to your boss, or send this to your family. So that threat of putting that image or video out in the world through email, through videos, through social media, whatever that may be, that can be considered sextortion, and that could be a federal crime that may be committed. So this is the power and control wheel. And like I mentioned, all of these are tactics that are used to gain and maintain control over the victim. The inner circle is the tactics that are just explained here. And the outer circle in red are the assaultive behaviors, abusive behaviors, and the ones that people could, file crimes against a person, like sexual assault, physical abuse. And at the end, in the middle, you see that domestic violence is a form or a tactic of power and control. One person trying to control or maintain power over another. And that in most cases is a vulnerable person, someone who may not be able to stand up for themselves or fight back, or there's other reasons why that survivor victim may not be able to break that cycle or leave the situation. This is what we call the cycle of violence. And the cycle of violence is also a wheel to help us identify the patterns of abuse in a relationship. This cycle of violence is also used in family violence cases, elder child abuse, right? There's always this phase of a relationship or a family dynamic being calm, being, there's no tension. There's promises that are made. Everything's calm. Then as a person, we start feeling some tension, right? Because those tactics that we just went over with are utilized. Sexual violence, maybe sexual harassment, many times abuse starts with the emotional and psychological, the name calling, the threatening or intimidating behavior, right? That's when the tension starts building. This is where the abusive person may get angry, and there might be incidents of abuse, maybe subtle, but the tension starts building up. Here, the victim or the family members may feel like they're walking on eggshells. They can't say or do certain things because if they know that if that you're at this tension phase, then we have the explosive stage, which is the abuse happens. And that abuse can be the episodes of violence. It could be physical, it could be verbal, it could be sexual assault, it could be also economic abuse, it could also be spiritual abuse, but it could be all of them all in one as well. It's not just one or the other. It could be all different types of actions that the victim is feeling fearful and is being harmed. Then we have the honeymoon stage, which I call, or the makeup stage. This is where the abuser uses the tactic of, I'm so sorry. If you wouldn't have said that, if you wouldn't act a certain way, if you maybe you would be better at doing certain things the way I want them to be, that is the abuser not taking accountability for their actions, but blaming the victim for the abuse that is happening to them. And this can then make the survivor feel like, this is my fault. I'm responsible for the violence that is happening in my relationship, in my home, in my family. And then you have the calm stage again. So what we're trying to do by having these conversations and discussing these patterns of abuse and how to support survivors, we're trying to break this cycle of violence so that all members of our community are violence free. So why does domestic violence and family violence happen in our community? And that's a question I have for you. And we may all have different perspectives or ideas as to why it happens, but we really, when we're talking about violence in our community, violence in our homes, in our relationships, we really have to look at that and understand that people who abuse choose to have violent behaviors. They choose to abuse and control and have power over. Uh, it's not caused by alcohol or drugs. It's not it's not an anger issue. It's a decision that that person makes to harm another. Violence is a learned behavior. If we see violence growing up as children in our home, we most likely will learn to use those tactics and those behaviors in our own relationships as adults. If a young woman, a young child grows up witnessing violence and seeing the negative or unhealthy relationships, they're going to normalize that and say, well, that's how my family was. And so therefore it's normal. If a young man, a young boy sees that their father or a person in the family is being abusive, they're going to use those tactics and behaviors. So again, violence is a learned behavior. If you could learn it, you could unlearn it. And that's our process here. Violence is influenced by institutional and societal responses. How we respond to violence and act or treat victims is very important. We really have to look at the roots of violence. Why does violence happen? Well, the roots of violence is connected to racism, classism, ageism, and just targeting the less vulnerable or marginalized community. And so we have to have these conversations about the isms to really understand the roots of violence and how this is all connected to institutional and societal responses. Violence is found in every level of society. It does not discriminate. Anyone could be a victim of family violence, intimate partner violence. It doesn't matter your background, your religious beliefs, if you live in a rural community, violence can impact anyone. And again, domestic violence and family violence is power and control. We ask ourselves, why do survivors stay? Why do survivors stay in a relationship that is abusive and unhealthy? Why do victims stay in a family dynamic that is unhealthy? Well, there's many barriers to why victims choose not to leave. And number one is fear. We believe that victims are the experts in their situation and they know best what they can and cannot do in a situation. Uh, we there's this they believe that the situation is their fault. They are guilt into believing that they're to blame for the situation and the abusive relationship, cultural differences as well, and social norms. And believe it or not, love. They feel that the person that is abusing them can or maybe could change their behavior, and they love them, and so they want to make sure that maybe it's a possibility that the abuse may stop, but in many cases it doesn't. It continues. Many survivors don't know that there are options out there for them, and they might assume their lack of options as resources, a domestic violence station, a shelter, counseling, support. Also, a lack of options could mean not having a support system for them that can guide them through the process of getting help. The children, they want the children to have a family unit, the parents together, and separating them is maybe not an option for them. And we also need to consider that victim blaming can be a reason why survivors decide to stay in the relationship. How we respond to survivors and treat survivors as service providers is vital. If we respond in a non-trauma informed way, in a negative way, and they have a bad experience, that survivor will not reach out for help again. Just think about this. If you ever come in contact with a survivor and discloses their story to you, you might be that first person that they told their story to. So your response and your reaction is very important. Many survivors are in denial that they're in an unhealthy or an abusive relationship. And so that might be an opportunity to educate survivors on these issues and the tactics. Financially, survivors are not able to live dependently on their own because their finances have been ruined by the abusive person and they don't have the financial resources. Another reason why they may stay is religious beliefs. And then you have trauma bonding. Many times survivors normalize or think that they've been through so much already that they are connected to that person that's harming them. And so being without them is not an option. And so that trauma bonding comes into play where survivors are unable to leave the situation because they feel that they're connected to that person that is harming them. In in all, violence has an impact on survivors, and it has an impact on children, and it has an impact on our family. Uh, when we experience physical abuse, obviously we have physical injuries, right? But those physical injuries and psychological abuse, emotional abuse can also lead to PTSD and mental health issues. Then survivors try to figure out other coping mechanisms that may not be so healthy options, though, right? And so substance abuse might be an issue where they might end up using that as a coping skill. Um, it also damages the relationship with children who are exposed to violence. There's this belief that survivors that if the children don't see the violence happening, you know witness it directly, that they're not being impacted, but that's incorrect. Children will and are harmed by just being in the home where there's violence, and you'll get another training on that next Friday. And there's also the economic consequences as well. And survivors also experience the lack of the social skills to connect with service providers or others because of the isolation that they've experienced from that abusive person, not allowing them to have access to other people or other resources. There are also long-term effects, and that could even include health effects. Many survivors, and y'all heard of the ACEs study through Kaiser, that survivors may experience uh, um, autoimmune diseases, deficiencies, mental health. And so this could be impactful for a person that is currently or has currently experienced violence in the home. There's also the flashback and triggers that may come up for survivors as they're working through their process of healing. And then also the re-victimization that they may experience. They may leave a relationship that was unhealthy and abusive, but many times end up in another relationship that is also abusive and unhealthy, and or they are maybe service providers that may re-victimize victims, and then when not knowing, maybe knowingly or unknowingly, and that could also be impactful for survivors. So what we're trying to achieve at Peace Over Violence is exactly what our mission is: building healthy relationships, families, and communities free from sexual and domestic interpersonal violence. This is the wheel of equality. This is where we want people to have respectful interactions, not threatening behaviors, negotiating and fairness, economic partnership between relationships, shared responsibility, responsible and co-parenting, right? Honesty and accountability, and trust and support. That is what a healthy relationship looks like. And many times survivors don't know those dynamics of a healthy relationship. So it is very important for us to try to identify those as well. They may know that the unhealthy ones and the tactics that we just described, but what is a healthy relationship? Well, do you have effective and honest communication? Are you both respectful with each other? Is there trust in the relationship, not jealousy, right? Is there honesty? Is there equality between both partners or family members? Are you able to enjoy personal time away from each other and not controlling and being there consistently? Are you making mutual choices and decisions about the relationship or the family? Or is there economic and financial partnership? So that's the healthy part of this. The unhealthy is what we just described. And the abusive part is, a pattern that kind of leads. This is like a continuum. Some relationships may end up starting in a healthy pattern. And then there you have the signs that are unhealthy that we just discussed, and the abusive tactics that are used. So for me, I think that one of the things that I've discovered is really having conversation with survivors and educating them about what is a healthy relationship and what would you want in your relationship to look like. What are things that you want from this relationship that will make it safe for you to be in the relationship. As service providers, we have to consider incorporating some best practices when working with community, when working with families. And one of the things that I would encourage is to have a screening questionnaire to help identify if there is violence happening within the home. What are some questions that you could ask? Has there been any recent reports of domestic violence? Are you in fear of your safety? Are there any questions that may identify red flags for you to help the survivor, but also for you to identify if it is safe for you to visit that home during that time, especially if you identify red flags? Maybe it might not as be safe for people to be interacting with in home visiting, or maybe thinking about safety planning with survivors. So these are questions that could best support survivors in a very structural way. We want to make sure that if the survivors sharing stories or experienced with us, that we are being respectful of their privacy, and then we maintain confidentiality of that story. And only the survivor has the ability to share or give consent for us to share their experience. Many of you may be mandated reporters, and having transparency about your requirements to report abuse, or if you notice any abusive patterns in the home. And honesty is important to inform that survivor that you are a mandated reporter, and if there are signs or you witness any abusive behavior, that you are required to report. I would also say if your agency is an expert in domestic violence, that's great. But collaborating with domestic violence, your local domestic violence agencies or shelters to best support you. I honestly feel that working together as a unit and partnering with other organizations is the best way to help survivors. No one agency can do it alone. We need to work together to help our community you know, with when they're experiencing issues of trauma. Training personnel on the dynamics of domestic violence, the nexuses of domestic violence related topics, and how to best support survivors, crisis intervention skills. Those are additional topics that Peace Over Violence can offer, as well as any other domestic violence agency. And all these practices must be trauma informed. I feel that having a trauma informed caseworker, supervisor is very important in building these practices. So as trauma informed response, we know that it is a way to engage people who have experienced trauma that acknowledges the impact of the trauma and aims to prevent re-traumatization from the service provider or anyone else. And so what we do is we want to make sure that if you're working with individuals that maybe having a basic skill set on crisis intervention skills, and you may not be able to solve the person's problem completely, but if we're able to triage and connect that person to the appropriate resources, our goal in a crisis response is to reduce the level of trauma that they're experiencing at that time. The longer impact, the longer issues, it is important to connect them to a domestic violence agency. So that way we are able to provide and offer different modalities, different healing options for the survivor, and also maybe some coping mechanisms so that they could then move forward with their healing process. So the goal of crisis intervention is for us to work with survivors to promote safety and emotional stability for them at that time. Doesn't mean that crisis might not come back again, but at least if we are able to have some coping skills for them, breathing, journaling, calling a 24-hour hotline to talk to an advocate, a confidential advocate, those are some strategies that can be utilized. If someone is sharing their story with you, is listening without judgment and validate their feelings and their experiences. Come from a place of empathy. That person is experiencing or has experiencing pain, and it's very hard and very courageous for someone to share their story. Sometimes it could be embarrassing for a survivor to even disclose what they've been or going through. And so that empathy and that support is very important, how we are listening and validating their information. And then let's help them understand that the impact of trauma and offer coping strategies, right? That could also lead to identifying the person's strengths and their competencies. What are they? They're brave for sharing their story. They're brave for taking care of their children and putting their children first. Identify those strengths because all they've been hearing is negative. Listen without judgment, but listen with your heart, and honor the stories that they're telling you. I also say in this part, if you are a survivor yourself, please, as much as you can, sharing your story, I think you might think it might be vital, but sometimes when we share our own experiences, that might take away from their experience, and then the focus is now on you. So that's another part of that. Convey an outlook of hope and possibility. And it's not a promise. We cannot promise that that violence will stop. That is not something what we do. Normalize their experience. It's normal for you to feel frustrated. It sounds like you've been through a lot. I can't imagine you having to go through that on your own without any support. I'm here to support you. How we talk to survivors is very important in communicating that empathy and acceptance and compassion, and demonstrating that humility as well. If you don't know something or not sure about something, it's okay to say it. I sometimes find myself not knowing much in certain situations when it becomes difficult to answer a question for a survivor. and then support them through their self-determination. It is their choice. If they decide to stay, to leave, to give the abusive person another chance, that is their choice. See the person as a person, and then most importantly, I believe you. I believe that you've been through this, and I want to support you, because many survivors think that no one's going to believe them because that's what the abusive person has said to them. In general, we want to make sure that we're connecting all our survivors, all our community members with the appropriate resources. Obviously, if it's an immediate crisis or an immediate incident, 911, police response. I know that there is a distrust with police right now, but I'll talk about our domestic abuse response teams programs that are currently rolling out in Los Angeles, LAPD. Having a list of local hotlines, and you all should have already received a survivor referral sheet from Peace Over Violence with your packet, your PowerPoint packet. Those are all referrals that have been vetted for you to connect survivors. And hopefully within your county or within your city or locally, if you feel like those are not resources that are appropriate for your city or where you're located, please feel free to reach out to me. I'll be happy to provide additional resources. Along with that, I provided the victim notification every day. If there's an arrest, this victim notification every day gives an update of the person that is incarcerated, release, movement, any information. This was created because we've seen that once a person is released from custody, immediately they go and try to retaliate against the victim. This form will notify the victim. Inmate Information Center is through the Sheriff's Department. There you can look up how or what charges the person is being accused of. And of course, 211 is one of our biggest referral guides via telephone through the county. There's also the Restraining Order Clinic, LACBA. They provide pro bono services, attorneys that will assist survivors. Peace Over Violence also does provide services for restraining orders for clients that are enrolled in our services. And then Safe at Home is a confidential address information. So if the victim leaves and they want to maintain their address confidential, they could sign up for the Safe at Home. Please also contact your local trauma recovery centers. These are trauma recovery centers. Peace Over Violence is one of them. We work with survivors of crimes and we help them through the California Victims of Board Compensation process. They have additional resources and sometimes emergency funds that could support victims and maybe pay for additional counseling sessions, relocate or pay for any damages that have been done in the home. They also pay for funeral expenses. There's a certain limit, but there's more information on that. At Peace Over Violence, we do have a 24-hour hotline that you could give survivors these numbers. If they're wanting to speak to someone, this is 24/7. All our advocates have been trained. They've received an 82-hour training, and they are there to provide non-judgmental, confidential services to survivors. This can also be something that you could utilize if you're working with the survivor specifically at this time, and you are like, I need some additional support. You could also call the hotline with the survivor, and advocates will be there to provide you with support and how to manage the situation and give you additional resources. Peace Over Violence also provides comprehensive case management services. This means that we will go out to court, criminal court, dependency court, guide the survivor through the criminal process if they decide to report. We also have housing support services. Currently, we have emergency funds where we could help survivors pay for utility bills, moving expenses. If they want to relocate to another state, we also are able to help with that right now. This is limited funding, but it is a very, very beneficial services because we've been advocating that in order for survivors to thrive, they need to have the financial resources to be able to be self-sufficient. And this is one of the best resources that we've gotten. Our domestic violence response team currently at Peace Over Violence, we work with Central LAPD, Hollywood, and Northeast, and we also have a DART team in Pasadena. This is where a police officer trained, specially trained, trauma-informed trained, is paired up with a domestic violence advocate, and they respond on scene when a domestic violence call comes through, and they're there to provide services immediately for the victim and the children. This could mean shelter placement, helping, maybe advocating for an emergency protective order. An emergency protective order is only given by law enforcement. They call an on-call commissioner or judge, and that is when the victim is in fear of their life. And there's been physical proof that there's been physical abuse. And that EPO, emergency restraining order, is good for 7 days. This gives the victim time to go get a temporary restraining order. We also have, like I mentioned, our trauma recovery services, where additional support services and financial services can be utilized. If there has been damage to the home, the victim does not have any financial resources, CalVCP may be able to support that victim financially to replace any of the damages or pay for other like maybe dental work or medical procedures that they may need due to the violent crime. At Peace Over Violence, we do offer free counseling and support groups for all types of survivors, youth, people with disabilities. We also have a specialized deaf services program in our deaf community. They're at higher risk of being victims of crime as well. And we also provide prevention education and professional training. So this is maybe a 2-hour, 3-hour topic condensed into 1 hour and a half. If you feel that your team needs more support or services or training, please feel free to reach out to us. All our services are offered in English, Spanish, and American Sign Language, and we also offer interpretation services. In the Los Angeles area, currently, we've seen an increase of Indigenous community members who are also marginalized community members, and not a lot of agencies offer services in their language, Mixtec, Zapoteco. Those are different Indigenous languages where we partner with interpreters to provide services to that community as well. And this is my phone number. I'm sorry, my phone number and my email address. If you by chance have any questions or comments or follow-up requests, please feel free to reach out to me. Our Peace Over Violence office is in Los Angeles, and we also have an office in Pasadena. We serve the West San Gabriel Valley area, 22 cities. If you want more information about Peace Over Violence, this is our website. I strongly encourage you to look up our website. We do have volunteer opportunities available for our community to work with our survivors. And I think I'm going to move now to the Q&A, if that's correct.
You are correct, Yvette. Thank you so much for such a valuable presentation. My gosh, you covered so much info. And you have a few questions that came through the chat. Before I get to the questions, though, there was somebody who said, thank you for saying that violence is a choice and can be unlearned. I really wanted to make sure that you got that comment. I thought that was really great.
I appreciate that.
Yeah. Okay, so here we go. So the first couple of questions were about the terms that you shared in the beginning of your presentation. The first question is there a new name for the term perpetrator, or is there like a preferred term now?
Yes, there is. I know that there's different terms being used, abuser, perpetrator, but now we're trying to move from perpetrator to the person that has caused harm.
Person that has caused harm.
Yes.
Thank you very much for that. All right, your next question is it acceptable to use the terms IPV and BV interchangeably?
Yes, it is. It is acceptable, and those terms are interchangeable loosely on domestic violence, intimate partner violence, and we also include the teen dating violence. That's connected, so absolutely.
Thank you so much. I know you spoke a little bit about gaslighting, and someone is asking, would gaslighting and blame be considered abuse?
It is, gaslighting is a tactic that is used by the person that is causing harm. And like I mentioned earlier, it's undermining the victim survivor's sense of reality and not taking accountability for the actions and the abusive tactics or behavior that they're using. So uh, gaslighting could be used in many ways. And now it's also connected to being coerced into doing or thinking certain things, manipulating the survivor. So it can be, and I would encourage that anyone that is experiencing that if they're reporting, that they identify that as such. The more details that they give in a report, the better.
Thank you so much. All right. So your next question is, how do you help the victim when they deny the abuse when reported? You know, that's a very complicated question.
Yeah, I think that, like I said, it's up to the survivor victim to choose if they want to stay in the relationship. And if they're denying the abuse, I believe that then they are not ready for help. It's only when they identify that this is unhealthy, it's unsafe, that's when a survivor starts seeking help. And the best we could do, how do you help a victim when they're denying abuse, is to try to educate the person about the dynamics, about the patterns, not telling them, oh, you're being abused, but let's do some education. And I think this is why it's important for us to be out in the community, having these topics and presenting these topics in high schools. This is where it starts. And that way we are able to, have these conversations with potentially people that already or may experience these types of patterns of abusive behaviors.
Thank you so much. Okay, so this next question is definitely relevant to all home visiting staff as mandated reporters. So this question is, as a mandated reporter, or as mandated reporters, do we only report if we see physical signs or if they tell us about DV? So I guess they're asking if they should report it when they see physical signs, or if they're only allowed to report it when the client is actually sharing that they are experiencing DV.
That's a good question. I think that most of your agencies might have different procedures, and I would definitely encourage you to seek your guidance from your policies, procedures, and practices. My understanding is that either it's both, right? Identify, witness, and or disclosure. So that's important to know.
Okay, so witness and disclosure. Got it. Yeah, whoever asked that question, we do encourage you to check in with your policies at your own particular agency. Okay, so we do have just a couple more questions for you, and these are about peace over violence in particular. The first question is, does peace over violence continue to assist the victim after they relocate them to another city or state, i.e. counseling, job assistance, housing, etc.?
Yes, absolutely. We think that it's very important for us to maintain that survivor-centered approach and in connecting with survivors. If they're relocated, go to a different state, we also consider doing warm handoffs to other organizations within the boundaries that they moved into. So like I mentioned, it's important for me. I believe that this collaboration and working with other organizations is key to supporting survivors through their process of leaving an abusive relationship. And so we do comprehensive case management. We stay with the survivor as long as they want us to.
That's really, really great to hear. So I'm going to combine these next two questions. Someone is asking if your services are available in San Fernando Valley, and then also asking if you serve the Long Beach area as well.
So unfortunately, our services are not available in the San Fernando Valley, but you have an amazing organization out there that is called Strength United. And they actually are very similar to Peace Over Violence. They provide services to domestic violence and sexual assault victims. And they also have a domestic abuse response team out there. So they serve the San Fernando Valley. Long Beach, I would definitely recommend you to contact the YWCA of Greater Los Angeles, and then the Long Beach Women's Shelter out there as well. There's a lot of organizations within different cities that have amazing services and are willing to partner with other organizations.
Great, thank you so much. That sounds like something that the consortium could work on putting together resources that are specific to all these different cities. That's very helpful. Thank you. Okay, and then we have one final, oh, actually, sorry, there's two more questions. So somebody just wanted some clarification. If someone intentionally is giving their partner an STI, is that illegal? And they said, I get this question a lot in classes from those that have experienced IPV.
So no, it's not illegal. It's a tactic that is used. However, I believe that if it's another HIV infection, that then is different. And so it all depends on the situation. Again, I would go back to if that person knows that they have a sexually transmitted infection or disease, that they include that in their report, because it's important to have more information to get protective orders and maybe file move forward with the criminal process. It's not against the law, but it could also be mentioned.
Okay. All right. And then our final question in the Q&A, does Peace Over Violence offer services that are specific to males and or fathers?
Absolutely, yes. We actually have started a male domestic violence support group, both in English and Spanish. And we also provide case management, all our services, legal advocacy, immigration services to male survivors of sexual violence and domestic violence. And so absolutely, we are open to providing services to males, youth, non-binary, LGBTQ community as well.
Thank you so much. Let me take a look at the chat here just to make sure we didn't miss any questions that might have come through. But we got through all of our other questions. I see that there are 2 hands raised. If you have questions for Yvette and you want to just pop those in the chat really quick, we have some time and we can get to your questions as well. Let's see. We already got a lot of thank yous coming through. Great information. This really was great, Yvette. Thank you so much.
You're welcome. And I want to thank everyone again for taking the time for being here on a Friday, Domestic Violence Awareness Month. Support your local domestic violence agency, support survivors, believe survivors. And I do want to appreciate you for having and hosting these events to share the information. I hope that everyone signs up for next 2 Fridays, which is DV Impact on Children, and also the domestic violence legal remedies for survivors in our community.
Thank you again, Yvette. Thank you so much for joining us this morning. And thank you everyone for attending this Friday. I did drop the evaluation link in the chat, but as I mentioned previously, once you leave the webinar, there will be a prompt that sends you directly to SurveyMonkey. So please take a few minutes to fill that out for us. And we hope to see you next Friday as well. Thank you, everyone. Bye. Have a good rest of your Friday. Getting a lot of love in the chat, Yvette.
Thank you. Thank you, everyone.